Okay, let's talk about X-linked recessive disorders. Remember, these diseases most commonly affect males who always inherit it from their mother. You can identify these in a family tree using the process of elimination. So for this tree, you can tell it can't be autosomal dominant or X-linked dominant since you don't see it in all generations. And it's not mitochondrial since nobody's getting it from their mother. So it could technically be either autosomal recessive or X-linked recessive, but this one's more likely to be X-linked recessive. First of all, autosomal recessive diseases you will almost never see in more than one generation, since at least for the sake of the test, you should assume that it's rare in the population, so the odds of both grandparents being carriers and this other male being a carrier are almost non-existent. It's a lot more likely that there's only one disease allele, which is getting passed from person to person. What's going on here is that the grandmother in this family is a carrier for an X-linked recessive disease. So she doesn't have the disease, but she can pass it on to her son. And he will be affected since he has no normal copy to make up for it, like his sister does, over here. And then she can pass it on to her son the exact same way. In your book, you have a list of the most common X-linked recessive disorders, and a nice mnemonic you can use to remember them. I recommend that you go ahead and commit these to memory, because on the test you may get a question that describes one of these diseases, like Hunter syndrome, and then since they like multi-level questions, they won't just ask you what the disease is, but they'll ask you what type of inheritance pattern it has. So you'll need to know that it's X-linked recessive. Hunter in particular is easy to remember if you just think of the mnemonic Hunter's aim for the X. Again, these diseases are covered in more depth in other places, but using this list and this mnemonic can help you remember which diseases are X-linked recessive. So, a concerned mother brings her 5-year-old child to the pediatrician's office. She explains that the child has been healthy since birth, but has recently begun to have difficulty standing up. The child has very large calf muscles, and he is diagnosed with a genetic condition. Which disorder shares the same inheritance pattern? So like a lot of questions on the step 1, this requires 2 steps to figure out. The first step is diagnosing the condition, and the second in this case is picking a disease with a similar inheritance pattern. So first of all, what disease does this patient have? Well, the real giveaway here is the very large calf muscles in a child, which should really make you think about muscular dystrophy. The fact that the patient is a male and is 5 years old will confirm this diagnosis, and further suggest that this is Duchenne muscular dystrophy. Alright, so what's the genetic cause of muscular dystrophy? A mutation in the dystrophin gene. And what's the inheritance pattern? This would be X-linked recessive, which is why you pretty much only see it in males. Alright, time for the second step. So which of these diseases is X-linked recessive? This would be hemophilia A, which is answer choice C. So I know it's not something we covered in depth in this section, but hopefully you've seen this before, and it is mentioned in our list of X-linked recessive disorders. You can also use process of elimination for a question like this. So what are the modes of inheritance for these other diseases? Well, cystic fibrosis and hemochromatosis are both autosomal recessive, whereas Marfan syndrome and neurofibromatosis are both autosomal dominant.